Good afternoon. I'm Allison Boucher Jarvis, Vice President for Human Resource. And this is the first part of our series today regarding William Patterson's plans to return to campus. My colleague, Senior VP and Provost, Josh Powers, will focus on the second part, Academic Affairs, at 12:30. And my colleague, Nikki Camarada, Vice President for Student Development, will focus on the third part, campus life, with a particular focus on residence life for our students shortly thereafter. William Patterson is planning for students, faculty, and staff to return to campus for the fall semester. The Reopening Preparedness Committee, co-chaired by Dr. Jill Guzman and Charles Lowe, is working with state and local public health officials to develop an approach to enable a safe return to campus. The foundation of this plan includes state guidelines for reopening, public health guidelines for higher education, and COVID screening for the campus community. Opening safely is our highest priority. The components of the Human Resources Return to Work Plan include phasing, workspace and hygiene, policies and training, accommodations, screening and tracing, and a communication plan. The university will be requiring 6-foot distancing and facial coverings when in the presence of others, with some exceptions for resident students in their private residence. Cabinet is currently reviewing for approval policies regarding self-monitored temperature checks and health screens and testing and contact tracing. These policies will be announced and posted once approved. Phasing. We will be returning to work gradually, and our plans are currently underway. We'll be starting at a 25% staffing ratio and then moving to 50% as conditions allow, and remote work where possible. This is based on the definition of essential employees status at that time, advancement from phase 2 to phase 3 at the state level. We'll also have staggered scheduling, and we'll make more announcements about that, the black and the orange, and staggered start and stop times. And this will ensure that our population density will allow for social distancing indoors, and again, face coverings will be worn indoors when social distancing is not possible. The staggered start and stop times will allow for our entryways to be less dense at the time of start. Next slide, please, Greg. So we will have policies and training developed to ensure the campus is safe. So physical distancing and workplace cleaning e-training will be required before returning to work. And there will be policies on employee and supervisor training related to sick leave, extended sick leave, attendance, return to work, and travel policies, as well as COVID-19 workplace expectations, accommodation policies, working remotely, ethical and professional requirements for a safe environment, and contract tracing and employee screening. Next slide, please.
At this time, this is Denise Robinson Lewis, and at this time I will speak on the workspace and hygiene protocols. So in addition to the cleanings that are conducted by facilities as their routine, as their portion of the process, employees are now going to be asked to keep their workspaces clean as part of our health and safety issues in reducing COVID-19 exposure. Physical distancing using the 6-foot distance CDC guidance will be implemented. Plexiglass barriers are also implemented as we speak. They are already in place in many areas. Personal protective equipment in the form of reusable cloth masks will be provided to employees, as well as hand sanitizers in your particular office, as well as those high traffic areas. We will also be looking at policies around office openings. When will we fully open to the public, or will we be working more from an appointment basis or as necessary, and in some instances, possibly virtually 100% of the time? The other issues that we are looking at as it relates to this is virtual communication, continuing to use virtual communication even in instances where we are actually physically in the office together, as well as in those instances where it's necessary to maintain the distance between us and some of our customers. And finally, there will be an assessment of our meeting space usage so that we can comply with social distancing requirements. For instance, team meetings staff meetings that may have formerly been in a conference room may now be conducted virtually. Even though we may be in the office, it can still be something that we do in a virtual environment. In terms of hygiene protocols, we will obviously continue to recommend the hand washing, frequent hand washing, as the CDC has recommended. Wiping down areas, including those common areas such as galleys and break areas, etc.
Okay, thank you, Denise. The next slide. So employees who are expected to return to the workplace and have a medical condition that places them in a higher risk group for COVID-19 infection may wish to seek a reasonable accommodation. These employees should complete a COVID reasonable accommodation form, which will be on the COVID webpage. And there's a particular section for human resources. These forms should be submitted as soon as possible, but no later than July 13th, 2020. We understand that there may be some accommodations that arise after that date, but we would like to have any accommodations that we know about now to be submitted as soon as possible. There are also some other policies and laws regarding closures for parents of school-aged children, as well as policies to care for members of the household for those who are exposed or have COVID-19. There's another wonderful resource, a free resource, our Higher Ed Employee Assistance Program, which is a resource for managing stress and mental health and everything associated what we're currently going through. It is a full service resource. It covers anything from elder care, child care, financial hardship, fear. They are a third-party vendor and 100% confidential. Next slide, please. So what are the COVID-related ADA medical conditions? And you can see that on the slide. So if you are deemed eligible for an accommodation, you would speak with your supervisor, chair, and dean to review remote work options that may be available. If there are no suitable options, please contact Human Resources to determine next steps. So individuals with certain conditions may have a higher risk for COVID-19 infection, and are covered by the American Disabilities Act, which is governed by the EEOC. So those conditions may include asthma, moderate to severe, being immunocompromised, chronic kidney disease, being treated with dialysis, chronic lung disease, diabetes, HIV, older adults, age 65 years and older, serious heart disease, and severe obesity. Next slide, please. As we stated earlier, the university is currently creating tools and protocols for contact tracing and daily health screening in accordance with the CDC guidelines. WP-specific policies and procedures will be shared with the community once they become available. Next slide. The most important part of making sure that our employees feel that the campus is as safe as possible when we return is communication. So we'll continue to have town halls for targeted groups, including faculty, staff, supervisors. We'll have a dedicated COVID website with our plans to return. There will be frequent email communication, and we will have FAQs that are updated weekly. The guidance is dynamic, and every day the university and the preparedness committee get closer to finalizing these drafts, which will be shared broadly. On future town halls, we will have more specifics regarding screening and phasing. We are well on our way to completing these policies. We have a number of folks on hand to help answer questions. Jim Shelley, Director of Physical Plant Operations, Veronica Ruiz, Associate Director of Human Resources, of course, Denise Robinson Lewis, Director of Human Resources, and we have Jill Guzman and Charles Lowe, who are also on hand to answer your questions. Now, I embedded a couple of the answers to the questions that were submitted to the town hall site. So if there are any further questions, if you can please use the chat feature, and Greg Cannon will assist me in letting me know what's out there.
Yes, hi, Allison. Hello, everyone. The first question, and I know you touched on timing a little bit earlier, but someone is asking if there's any more specifics in terms of when employees and supervisors will have training and when policies will be in place.
I'm going to pass that off to Jill and Denise.
So we will be, this is Jill, everybody, welcome. We will be getting guidance for the staged opening from the New Jersey state governors and executive orders. And our policies, actually, most of them have been submitted and are under review. And we will be submitting our plan for the university to the state within the next week or so, I would say. So we are moving along, so that would have to be approved by the state as well.
Thanks, Jill. And the accommodation policy is currently completed. We obviously have an accommodation policy. The only tweak that was made was which was the change that was made at the federal level to include COVID, the impact of COVID.
Okay, great. Thank you. The next question, Allison, you did allude to the need for, and I believe Veronica did as well, for employees to help keep their workspaces clean. We have someone asking if that extends also to faculty being responsible for keeping the insides of their classrooms clean.
Okay, so I'm actually going to throw that over to Jill and Jim Shelley, or if anybody on the call has an answer to that question.
Thank you, Allison. Good afternoon, everyone. This is Jim. So with regards to cleaning up the classrooms, each evening, your custodial team will clean and disinfect each classroom. Throughout the day, any of the frequently touched surfaces within a classroom should be cleaned and disinfected by, in this case, it would be the responsibility of the professor. So if there's an overhead projector or a screen that is used during the class, we would ask that the professor or the teacher cleans that surface. Now, we'll be providing disinfecting sprays and cleaning wipes throughout the campus and in each of these classrooms, so the products will be available. So just so we're clear, each evening, each classroom will be cleaned and disinfected by WPU's custodial team.
Thanks, Jim. What other questions do we have?
Okay, yes, thanks, Allison. We have several questions with regard to masks and whether or not William Patterson will be providing masks to employees.
Okay, I'm going to throw that over to Denise or Jill. But earlier in the slide presentation, I believe that each employee will receive two cloth facial coverings, which can be laundered. Is that correct?
Yes, that's correct. Each employee will be given 2 cloth masks. We will also have disposable masks available if somebody forgets to bring their mask, or if somebody, a visitor or a student, walks into any department. Each department will be provided with disposable masks to give to anybody.
Great. Thanks, Jill.
Thank you, Jill. Allison, we have a couple of related questions further to your discussion of accommodations. Someone is asking, they have 2 staff members that have already submitted documentation with regard to accommodations. Do they have to complete the form that you referenced on the website as well?
If they previously submitted a form, we can use that. The COVID-19 ADA form was an abridged form. So for instance, somebody who's over the age of 65 wouldn't have to submit anything, any documentation, just complete the form. So if they previously submitted a form, that's perfectly acceptable. Thanks for the question.
Okay, and then we also have someone asking if you can say what the timeline is for making decisions on those accommodations requests.
So Human Resources will be reviewing each form and will provide responses as soon as possible. We're asking folks to submit them before July 13th. So after July 13th, within 2 days, by July 15th, all forms will be addressed, but they will be addressed as they come in.
Okay, great. We also have several questions that boil down to what are the university's plans for what to do when a COVID case is detected on campus.
Okay, so I'm going to ask my friend Jill to help me with that one.
Sure. So, of course, just like we've had the same procedure since March, we will be working with our state health department and our local health officials. We are amping up our contact tracing procedures to make it easier to contact trace on campus, but every case will be handled as they come in, and it may be different depending on the contact tracing. But we are, we're really trying to look at all of our procedures to make sure that we expedite contact tracing rapidly and to work with the health officials immediately to mitigate risk. So I think that that's the most important thing that we've learned through this, is that'll be the most important piece of it, is the contact tracing. And we need everybody involved to participate in that.
And we will be training any staff at William Patterson who's involved in that process so they know how to do it appropriately.
Okay, great. Speaking of staff, we have a question. Someone is wondering if the custodial staff has been increased to handle all the additional need for cleaning.
So I'll hand that over to Jim.
Thanks again, Allison. With regards to the total number of staff, no, that number has not changed. However, we supplemented the equipment that we have on hand to address the additional cleaning responsibilities going forward. So to that end, he has purchased a number of disinfectant foggers, sanitizing misters, floor scrubbers. So we have equipment that will make the process much more efficient.
Okay.
Thanks, Jim. And as a follow-up to that, there are a few questions asking for a little additional detail on the extensiveness of the cleaning, like specifically, will chairs be cleaned, things like that, like the extensiveness of each classroom being cleaned.
So it is our intention to clean and disinfect each classroom each night. With regards to classroom seating, I think I might be treading on someone else's turf, but there will be reduced seating in each of the classrooms just to maintain the social distancing rules. So we'll have smaller classroom sizes, but so we're clear, each evening, each classroom will go through two processes. The first is the cleaning and the second is the disinfecting. So I hope that answers the question.
And it sounds like that would include chairs and desks and other high-touch surfaces.
That's correct. Also, all surfaces within the classroom.
Great, thank you. So Allison, the next batch of questions relate to the policy issue around enforcing the social distance and mask wearing guidelines and how faculty and staff should respond to students or others who don't follow the guidelines.
Okay, and I know that the preparedness committee is working on a set of ethical responsibilities as well as a mechanism to both understand the expectations and to hold our staff accountable for those expectations. So I'll throw it over to Jill for the beginning part, and I'm happy to close this question out.
Yes, so we are looking at, and this is one of the proposed policies, to have ethical standards that the university community, which would include students, would abide by. So the same standards that we would be holding employees to, we would be looking at holding obviously the same for students. We're also looking at the disciplinary process. So if your question is about students, we would engage with student conduct. Again, it's about classroom management, and maybe the provost would discuss this, I'm not sure, in his presentation, but it would be redirecting them, offering them disposable masks, tell them that the executive order in the state of New Jersey requires facial covering whenever you're indoors. So I think, again, it's about educating the population. It's about reminding people what the expectation is as a university community member, but they would have been given this information prior to returning to our campus.
Yeah, so the only thing that I'll say is obviously we're a community, and it is important to engage with community members in a cordial way. And when I was looking at the policies, I think it's really important to understand that we take the appropriate corrective action. And when we talk about the principles of progressive discipline, you don't start with discipline. You start with a conversation. You start with reminding, someone of the policy. If somebody's in your classroom and you're reminding them once, and then it happens the second time, then, a conversation may not work. So just based on that question, I think it was a great question. We probably do need some training with regard to how we are going to socially enforce the set of community expectations. So great question, and we'll add that to the list of trainings so that we feel comfortable doing it.
Thank you, Allison. And I know we've addressed this earlier, but there's a further conversation going on in the chat box, so I thought it would be helpful to return to the issue of cleaning in between classes. There's concern that if desks and chairs are not cleaned in between classes, that there is an increased risk, and how that would be addressed. Thank you.
So this is President Haldobler. Let me sort of, again, assure the community that we're working within the CDC guidelines and the state guidelines, and we will meet those guidelines. It's also important to remember that the CDC and the State Department of Health have indicated that the greatest risk for transmission is the lack of facial covering, social distancing, and following those protocols. The risk from surface transmission is relatively low. So we really believe that by daily cleaning of classrooms and wiping down high-touch surfaces, asking people to do that in their workspaces, that we will ultimately meet the guidelines. But it is impossible and unrealistic to expect us to go in between classes and wipe down every surface. It's not part of the guidance. Again, surface transmission is very low risk, but making sure that people understand facial covering, social distancing, hand washing is another big one, are in place will ultimately help protect us, help reduce risk.
Thank you, President Haldobler. Allison, our next batch of questions focus on whether or not the university will do temperature testing, whether they will offer COVID testing before the start of classes, and things along those lines. And since we're just at about 3 minutes till the end of this session, I suspect this will be the last question.
Okay, so I am going to pass that back over to Jill.
So we will be referring employees for testing outside, but the OSHE has come out with the guidance of health screenings that will be required. We will not require testing prior to employees coming back. If employees are interested in getting tested, we certainly can refer them to testing. But health screenings and temperature taking and reporting that will be conducted, and we're waiting for that policy to be approved. And as Allison mentioned in the beginning, that will be shared once that policy is finalized.
Okay. Well,
Allison,
thank
perhaps
you.
you have any. Sorry, go ahead.
Thank you, Jill and Charles, Denise, Veronica, and Jim, and thank all of you for your questions. We're getting close to the end of this session. We do have a list of the chat questions, so we'll take a look, and anything we haven't addressed, we will turn into answers to frequently asked questions. And I will now pass the baton to my colleague, Senior Vice President and Provost, Senior Vice President of Academic Affairs, and Provost Joshua Powers.
Hello, everyone. It is a pleasure to be with you today. Allison, I'm pleased that your session went first because the question of health and safety obviously is on everyone's mind, whether you're a staff member or a faculty member. And colleagues, those that were able to answer those questions, so much appreciated your transparency, your straightforwardness on those items. Those are such key issues. I'm assuming that folks that are here for this session are particularly interested, obviously, in the instructional model, which is which I will talk about, with the assumption that you've attended the first 30 minutes and heard some of those things. But obviously, if you didn't or had a question, of course, if that kind of a topic came up again, we'd be happy to answer as it relates to the health and the safety kinds of things. And I will make some references to it in my presentation. So if we can go ahead and pull up my slides, Greg, that would be great. Okay, so let me first say that my PowerPoint that you were about to see, as well as the more in-depth description, is now posted to the Provost Office website. So if you go right there, there's a link on top. You click on it, it will take you right to that spot, as well as what I'll mention in a few moments about some of the data that informed the plan. So you can certainly do that now or after the session, whatever you'd like to do. This particular content is written from the faculty members' perspective, so faculty understand and the staff understand what we're doing. I'm working now very closely with our folks in marketing about the appropriate communication to students and how that would be written would have a different sort of approach to it. So I just want to make sure that you know that that's coming as well. Okay, so we'll go to my next slide. I want to start with what undergirds or is the foundation for this plan. First of all, the Restart Standards for New Jersey Higher Education. In my campus message of yesterday, there was a link directly to do that. That came out about, I think it's just about 2 weeks now that's been out. So that fundamentally informs what we're doing here as it is informing all of our other compatriot institutions around the state. Of course, the CDC guidelines for higher education, which is a subset of a very large document and an attention area for CDC, also informs this work. The part that's been a particular joy for me, insofar as engaging in this as a joy, has been the collaboration and engagement of many partners in this. So for at least a month, I've been very engaged with Faculty Senate leadership, our union leadership, college leaders at different levels, deans, chairs, vice presidents have all been engaged in various forms, as well as student and faculty survey data. The student data was focused around their spring experience and their thinking about the fall. The faculty survey data focuses on the spring experience both for the faculty member as well as their impressions for the student. So I encourage you to take a look. Both the quantitative and the qualitative data is there, so you hear the stories from the students directly as well as the faculty and what they observed in their students. And then, of course, student learning and teaching pedagogy research is undergirding all this. What is the best approaches, whether you're in a face-to-face or a distance environment or a mixed environment, to deliver the best instruction for learning outcome achievement. Various principles inform this, but in the context of what I'll just sort of share here, certainly felt it important that faculty have options. You understand pedagogy, you've been teaching, you know what the needs of your students are, you know what learning outcomes are. You should have the ability to have some choice within that context. So that's one of the principles. Embed health-informed accommodation. My vice president colleague referenced those things in terms of the accommodation. That form's available for faculty as well, with a request that be completed by the 13th. Preserving the freshman experience and lab, studio, or hands-on intensive courses as much as possible is the core element that really makes us distinctive at William Patterson, particularly on the freshman side of the place. Our retention data for our freshman experience last fall is trending in a positive way. It's some percentage points above where it was last year. We believe that cohorting freshmen and the on-campus engagement experience where they had a chance to build close relationships not only with students but with community support persons was really key to that. Our students also have a desire to be back within a framework of safety on the campus. So that's a priority. We also know that by definition, there are classes, specifically lab and studio and hands-on courses, that simply need the kinesthetic experience to be something you learn and engage in the laboratory. So we wanted to make sure that we had a mechanism to support that to the fullest extent possible. And then obviously the last one, don't make it complicated. Let me say that that's been probably the biggest challenge, is how to keep it simple at the same time provide detail. It's been great to read the questions that you've already put in the chat room, and I'll respond to some of those. Some I hope will answer from this. It's everybody has a unique vantage point from this. So let's go to the next slide. Okay, so let me just place it in a simple context. There are basically three models, and these are the three models that don't include a standard course approach that I'll come back to in a moment. Hybrid 1, Hybrid 2, and HyFlex. Hybrid 1 essentially is the notion that you would gather your students every other week. Okay, so if you have a class that teaches Monday, Wednesday, Friday, or Tuesday, Thursday, for example, you would have half your class on one day and half your class on the other day. That's where the 2 comes in. Okay, and you would repeat that content in that context. If you teach a class once a week, of which we have a bunch of those, you would every other week have half the students come for the first half of class and half the students come for the second half of class. So that's the notion of Hybrid 1. That's the one that has the smallest on-campus footprint. So that's I guess the unique feature of that particular approach. Hybrid 2 is the one where you have the ability for 1 or 2 weekly gatherings. And this is the circumstance where it's best for on-campus needs, and the flipped classroom is the way. So the idea that you have the need for that hands-on. Again, I'll use that lab as an experiment, as an example. But it might be a broadcast journalism course where you need to have access to the booth to learn all those techniques. We want to make sure you know that you have the ability to, as much as possible, to utilize that space for the important learning outcomes that you can uniquely need to achieve in a space like that. The flipped classroom notion is the idea that you would, for example, put content available typically in an asynchronous way, where students could for example, see your recorded lecture, and then you come to class and you would engage that content. That's good pedagogy. That approach has been around for some time. Lots of literature about it, but gives you ability to use your on-campus portion as a means of engaging the students, as opposed to simply doing your lecture on that particular moment, if that's something you'd like to do. The HyFlex would be once a week. Every classroom now that has a podium and a computer has a webcam in it for capability for live stream right directly from your classroom. So whereas this spring, if you were doing synchronous learning from your home with your computer sitting in front of you like I am right now, you now have the ability to do that in the full classroom. So basically that gives you the ability to have half the students, for example, in your class at a given moment, and the other half of the students are quote tuning in at a distance. That's the advantage of that particular approach. And so the idea that would have the ability to rotate, but it also builds in the flexibility for the student to choose, or who may need to stay home at a given moment. They might need to quarantine, for example, and so they would be able to remain at home while the rest of the task can continue, and they can then tune in through to the quote simulcast, the live stream. Okay. So again, for hybrid and HyFlex, we typically recommend synchronous for the online portion of the course. That's obviously the other portion of the class. And for hybrid 2, we would recommend asynchronous, because you're already in class a fair amount of time. You build the content. There's not a need to engage them in the online part of it. You do the engagement on campus. Okay, let me go to the next slide. Okay, so let me talk for a few moments about the priority classes. So as I've mentioned before, priority classes come in two categories. The primary one is the 1,000 level freshman cohorts. As for example, distinct from the 1,000 level classes that have juniors and seniors in them, for example. So this is about that cohorting experience and doing as much as we can to enable that to remain on campus. So right now, what Jonathan Lincoln and the registrar's office are doing, they've completed an assessment of the capacities on campus with Jill and her team very actively in that mix for establishing a socially distanced maximum class capacity. All right, so I use that phrase specifically, so you understand that's what that number would be, and then if your class, for example, if your entire class can be in that space without having to, and be able to socially distance in that space, you would, quote, continue as normal. You would be able to have that class in that context. We are attempting to preserve that as much as possible for freshman classes, which does involve moving some classes around to be able to achieve that to the extent possible. Our colleagues in student development, we're working with them where we be able to utilize, for example, some of the ballroom spaces in a shared way with important co-curricular events that might need to happen in there to socially distance as well. And places like Shade, places like the library auditorium that haven't normally been used for academic classes, we would seek to utilize. We believe we'll be able to achieve this with the majority, but not probably all of them. So I just want to know that that's the intent there. For lab studios or classes requiring high hands-on, we're recommending the hybrid 2 model. Labs almost universally are too small to be able to have all the students in there at once. So, but it appears that we'll be able to do that at the 50% level. So that's how that would work. Last thing I would say is that there are likely to be some situations where some non-priority classes can in fact meet in their space because it's large enough to be socially distanced in there for all the students, and so those may proceed as normal without an online need. Okay, go to the next slide. Okay, so this is the flow chart. Greg, I don't know if you can make that a little bit larger. It may be a little bit small for folks to see. Again, this PowerPoint is available to you on the Provost Office website, but sought to provide a very straightforward way of helping you go through a decision tree on how this would work. So, do you teach a course that was scheduled to be fully online already prior to the pandemic? The answer is yes. Continue that course as normal as scheduled. If the answer is no, do you teach a priority course, meaning an 1,000 level freshman cohort or a lab studio hands-on, or of course with that in there, obviously. I know lab courses have some lecture with it in many cases. I will come back to that as a question because I know that's a subcategory of question that popped in the inbox. So if the answer is yes, is the classroom sufficiently large to enable full class social distancing? Yes, then continue course as normal as scheduled. But if the answer is no, that you're either not a priority or it's not large enough, then you select hybrid type 1, hybrid type 2, or high flex as your approach. We're asking you. Let me shift to this one over here, the red text. As Allison had mentioned earlier, mechanisms for instructors to seek a health-related accommodation on campus using that form, asking that be done by the 13th. Then if you come back to the flow chart, discuss and confirm once that information comes in, confirm with your chair and your dean the acceptability of your choice for that class, and then we move forward in that way. And then participating in IRT workshops and training to support fall teaching. I'm going to give Gammon Bartle a little bit to come back and chat about that. So that's basically the decision tree flow. So we go to the next slide. Okay, the other piece that that I'm not aware that others have thought on this kind of level about, although I suspect some have, as in other institutions, that what I just described before is about how to bring about social distancing and the safety in the classroom and the appropriate approaches. But it doesn't really address the matter of campus volume and flow. Okay, so what we sought to do was to embed a piece that would reduce the overall volume at any one time of students here, as well as the combination of different people that are here at any given moment. This has probably been the most complex way of thinking, but settled on something that we think threaded the needle of simplicity with what is probably most likely to bring that about. Let me say that this is not perfect. There will be exceptions within this mix because our students at this university are not cohorted, but it will definitely be a lot better than not doing it. So basically, if you're in a class that you're going to have to break up into 2 groups, everybody would use their roster, and it's alphabetized. So the first half of that roster would be group 1, and the second half of that roster would be group 2. For all doing that, that enables us to be able to have a consistency in that way. But in addition, for those of you that opt for hybrid 1, since the on-campus is every other week, we're basically asking that if you teach a 1,000 or 2,000 level course, you be on campus the first week, at a distance the second week, on campus the third, so on the odds, essentially. If you're a 3,000, 4,000 a grad level course, you'd start on the second week, and then go on the fourth week, and then the sixth week. So that's how that would work. Those 2 things will help to bring about better volume and flow control on the campus. Okay, we'll go to the next slide. Okay, just a few closing comments. Blackboard is the common LMS. We're encouraging you to use Blackboard for that too. It's what our students have been using, the majority of users on this campus. Zoom is now embedded within Blackboard, so you can use Zoom right directly in Blackboard. Number 2, in-field protocols, in-field courses, obviously we have many of those on those campus. They follow the protocols of the university and the sites that they're in. Those of you that are doing those, I know are active in that space. Support for the IRT, CTE in your college, and the training is definitely up. July and early part of August will be very actively engaged in that arena. The process for faculty and student health accommodation, the faculty part Allison described before with the idea that you would have those in by the 13th. The students have the similar kind of a process. They work through their accommodation through the ARC. So that's that. The last thing I do want to say is the fall semester is a week shorter, 1 week and 3 days shorter than it has typically been in a fall semester. The 14 weeks is the minimum that we can do per the Department of Education without a special unique waiver. But that requires the makeup of 3 instructional days. We are asking that those days are rather missing Monday, a missing Thursday, and a missing Friday. We're asking that the priority classes make up the classes on those days. It has to be coordinated because you have your Saturday class at that same time as you have the rest of the week. All right, so that's how that would work. If you're a Monday, you got 2 choices. If you're a Friday or a Thursday, we've given you the specific IDs in there. That will coordinate for the students as well as when they need to know they would be here on a Saturday. The rest can make it up. The one missing day, either in person or online. So that's how that would work. The last point I might make is around engaged learning opportunity. None of us imagined we'd be in this situation. I'm hopeful you will think about how this can be a strengthening opportunity for how the enhancing of our student learning outcome achievement through the notions of engaged learning, where you might use the online portion of it for content for the students to learn and engage, whether it's recorded lecture, whether it's support materials like might be found from different places like the Open Learning Initiative through Carnegie Mellon, or some of you have used some things from Labster.com, whatever it might be, some things that were some learning modules, and then they engage that content with you in the class. So last slide. This is simply a metaphor. This has been extraordinary for all of us for the last many months, and it continues to be. For me, the glass is always half full. Okay, I wanted to support the good work that you're doing out there. I'm not letting it get myself down. I know we'll have wrinkles and unique things that we're going to have to address. I've asked the deans to provide leadership in collaboration with the department chairs to help solve individual challenges or unique circumstances that you confront that perhaps I didn't specifically mention here. So that's who you should turn to for some guidance. And then, of course, they'll engage with me in academic affairs as necessary. So that's my PowerPoint. And now I will just respond to a few of the town hall questions that were sent in advance that maybe I didn't ask directly. And then in a moment, I will ask Gammon to speak because I know see your face up there. Okay. Can we have a policy in our syllabi that states that if students are showing any of the following symptoms, that they should stay home and will be excused? Let me say that right now we are working on some standard things you can put in your syllabi that's related to that, but it isn't just related to that. So that becomes a tool for you to communicate in addition to what we'll be sending directly to students about what's expected in the classroom. We're also working on some scripts that address where Allison had spoken about how we have some training on how do you appropriately, for the first time, address a student either not wearing the mask correctly, or maybe they're sitting together when they're not 6 feet apart because you have fixed seats in that particular classroom. We want to make sure we've provided you the tools and the things to share with them to be able to do that appropriately. So that's the example there. Let me speak about the lab things for a second, and then I'll take open questions. So the great insight here, labs classes typically are say biology, chemistry courses like that, they're 4 credits. They has a lecture component and they have a lab component. All right. We believe that you would want to maximize your lab's time, and so that's why we would suggest that the hybrid 2 is the model for you. For the lecture component of it, you have some flexibility. I'm asking you to use your disciplinary expertise, your collaboration with your chair as to whether it should be. Is that also something that you need to have, say, more regularly than every other week, which was hybrid 1, then do so. If you can make that work appropriately in the hybrid 1 model, then do so. I'd envision that your weekend would be your lab, since that is your hands-on. But if it turns out that's not how it works perfectly for you, you can have the lecture part of it if you needed. What's important, though, is to make sure it's the day of the week that's missing that needs to be appropriately on that line. And everybody has a lab on a Friday, or most people have labs on their Fridays, so that's why I was imagining that's probably going to be the day. That makeup day is going to be mostly for Fridays. Okay, let me stop and field questions. Greg.
Hi, Josh. Excuse me. So you alluded to this quite a bit, but there's a lot of discussion in the chat looking for clarification as to whether or not, in fact, faculty will decide for themselves which modality is appropriate for each class. And then along those lines, if they'll have the ability to change as circumstances change. And then finally, there's been talk about the Montclair state model, and people are asking if, like Montclair, students will know in advance what modality is being used for their class.
Okay, that was a triple bagger in that question. So
just trying to be efficient.
Repeat the first part of that again, and then I will answer that directly.
Sure. So they're looking for confirmation or clarification that the faculty member will have the choice as to which modality they use for each class.
The answer is yes, but you need to share that approach with your chair, who will be in collaboration with your dean to approve it. So I believe you know what the right things would be, and I imagine that's going to be a very seamless approach. But I do want to make sure that there's that oversight that comes along with that.
Okay, and then just as a refresher, the other piece of that was whether or not they would have the ability to shift modalities as circumstances change.
The answer is yes. So if in the middle of the class period, it's October 15th, and for some reason you get ill or need to quarantine, then yes, we need to shift it to online, for example, if that needs to be the approach that's needed. If Jill gives us guidance, for example, that we have a particular circumstance that's required that will impact this class in this way, that will be our green light that we need to go online and whatever approach that we need to do that. So we will take our guidance from our folks here on the campus around those things. And then the Montclair piece. So yes, right now there is a plan that we'll be launching next week on communicating with students. Those particular communication, how that's written and presented, needs to have a little different flair than the detail that you had in this way, but that is coming next week for those students, so they will know. Let me pause for a second, and I wanted to see if Gammon, would you just take a moment? Let me just say that her IRT has done extraordinarily good work for the last few months, and they are stepping up again. So get ready for some exciting things in July and August that folks can participate in. But Gammon, take a moment and explain what's coming. You're muted.
Great. Thank you, Josh, for the introduction, and I'm happy to briefly explain what we're going to be doing. It's the IRT's Center for Teaching with Technology, and we're pleased to be providing comprehensive faculty training in advance of the fall semester. The program will take place, as was mentioned, in July and August, specifically between July 13th and August 21st. And I will be sending out a calendar of events when the schedule has been finalized. So we'll have 3 modes of training: do-it-yourself, webinars, and one-on-one consultations. A lot of the do-it-yourself documentation is already up online. Lots of things about Blackboard. We have an online teaching toolkit and a lot of other documentation for people to teach themselves on the on our IT Wiki and also in Blackboard. The webinars, which I think will be especially interesting for folks, especially hearing from the provost what the different teaching options are going to be. We'll have a webinar on hybrid teaching, which should cover the hybrid 1 and hybrid 2 possibilities. We're going to do a workshop on Zoom for teaching and for recording videos. And this is because in the student survey, students said they really appreciated when faculty made videos, and you may not have a good way of doing that. So we're going to teach how to do that using Zoom. We'll also have a HyFlex teaching workshop. I'll be teaching that one myself live from a classroom on campus. And we'll also have an opportunity for hands-on practice with the webcams and microphones in the classrooms. So finally, the one-on-one consultations will be available as always. Just fill out a ticket for Teaching with Technology consultation at the Web Help Desk platform. So that's briefly what we're going to be covering for everyone. I hope that this is a good program for all the faculty.
Thanks, Gammon. Let me just also add that the CTE is developing some content they're going to put on their website that's also in support of pieces, and the flipped classroom, for example, is one example, and also how to do active learning in a socially distanced context. There's actually been some really robust information about that right now. When you're sitting 6 feet apart from someone, how do you actually do it? There are ways to do it. People are being very creative. So we're gonna try to curate some of those things to give you some ideas. Okay, Greg, back to you.
Great, thanks, Josh. There's a question with regard to the webcams. You mentioned that they would be in every classroom, but someone has mentioned that they're not in the art studios.
That is true. So that's why I was very specific when I said in a classroom that has a podium and a computer. But let me invite Eric Rosenberg to talk for a moment about webcams.
The reason the webcams require a computer, and some of the art studios and other labs do not have computers in them. So in that instance, we're recommending that the faculty member bring a laptop with them, and the laptop has an embedded camera and microphone, and hopefully that will work. And if an additional camera is needed, we hope to have a sufficient supply that you'd be able to connect a secondary camera for better viewing rather than trying to, just view on the laptop screen.
Okay. Thank you, Eric. Let me just give an example. So even though it may not be in that space, there are other solutions available. I'm imagining a lab experiment with maybe a webcam that needed to be above to sort of be shining down on something. Could be a way to do that in a laboratory where the webcam isn't present.
Yes, and we envision being able to use a phone in that instance as well. A cell phone has a fairly decent camera built into it, so it might be possible to use a phone in that instance as well.
And I believe that some faculty have actually did that this spring, where they were in the lab demonstrating something by themselves. Okay, other questions, Greg?
So this is a statement more than a question, but perhaps you can respond to it. Someone has said, I hope that you are not planning on charging the technology fee for hybrids or courses that will go online. And there were several other folks who seconded that.
The distance learning fee is waived for the spring for courses that are shifting to online. So a student who was already signed up for an online course, and that was the intent they did before the pandemic, or want to be part of that class, would still have that fee, but not for anybody else who's that's not what they signed up for.
Okay, thank you. There are several questions asking for more detail. I know you've already shared a lot about how the hybrid models would work, and specifically whether folks are expected to develop fresh content for the different modalities.
I'm not sure exactly how to answer that. I mean, obviously this requires some different thinking about how one delivers their instruction, and by definition, hybrid means there's some elements of that delivered online, some elements are delivered face-to-face. I guess that would really depend on the faculty member and which particular emphasis they wanted to take, and whether they chose their online to be asynchronous or synchronous. We're recommending synchronous to keep it as much as possible sort of something that feels like normal. Every new freshman on this campus is going to get a laptop when they come here. So they're going to be better equipped to be able to do, at least the freshmen will be better equipped in that way. So that will certainly be aid for those folks that have freshmen, although again, that's emphasized to be on campus as much as possible. Obviously our computer labs are going to be accessible for others that are on campus. So I guess that's what I would say at this point. It would depend on the instructor, but we're trying to, through the idea of having options, we're hoping that you can pick one that you feel most comfortable with, that matches the kind of learning outcome achievement you're seeking with your course.
Okay, thank you, Josh. There are several questions with regard to the physical classroom, and when faculty members would know the layout of their classroom and whether or not that classroom allows for in-person teaching.
Okay, also on the Academic Affairs website, hopefully this next week will be a third document that is the social distancing capacity of every classroom. Okay, we've been thinking all the ways we can get information out. That's the fastest. So once again, Jonathan Lincoln and Jill and others have been working hard to develop that. So you'll be able to go there and actually see, you can match out what class you're currently assigned to and the schedule of classes with that social distancing capacity, and see whether the numbers align in the right way for, shall we say, the 50% group thing. Some classes rooms have already been moved around to be able to meet that, given the priorities. Some more is going to be necessary, and I'm sure we'll be doing that more in the next few weeks as we go into August. It's just going to have to be there's going to be some adaptation in that regard, particularly if there's a faculty member who needs to teach fully online based on the health accommodation. So that's a little bit of a moving target, but that will be the first place you can actually see, can I pull off my choice? And then you'll work with your dean and your chair if it appears that you can't, and then that will trigger, well, maybe we can move the classroom, or some other things that we can do to address that.
Great, thanks. To Eric's point about laptops with webcams for spaces that are not already equipped with cameras, a faculty member is asking if they will be provided with such a laptop if they don't have one.
We're going to attempt to, during the refresh this year, anybody that has a desktop, we're going to refresh them with a laptop. Anybody that does not, any faculty member that does not, full-time faculty member that does not have a laptop that's scheduled for refresh in subsequent years, that needs it for a lab, we will be able to refresh your desktop for a laptop. but we're going to do that on a case-by-case basis. So at the end of this upcoming fiscal year 21, 1/3 of the faculty and staff will have a laptop. And the objective is within 3 years, everyone will. But if we need to do some sooner on a case-by-case basis, based on need, we will.
Thank you,
Eric.
Eric.
I know.
To clarify, by the way, in terms of students, freshmen are going to be required to bring a laptop with them. We're not going to be providing it. They're going to be required to bring one on their own.
I know some of those questions were from adjunct. You mentioned full-time faculty. Are there loaners available for adjuncts?
We can work that out with the department chairs. Some of the departments already have loaners for that purpose, and if they don't, we can work that out with the department chairs.
These are excellent questions, colleagues. Taking notes.
Okay, I do want to add that there's a lot of folks have seconded you, Josh, with your compliments for the good work of IRT. So I wanted those folks to know. There's questions seeking more clarification on the requirement that new students bring laptops. If I believe Eric might have just mentioned this, but whether they'll be paying for them or whether they're being provided by the university.
I'm going to make a suggestion, Eric, and maybe you have a sidebar. Maybe we can have just a general communication with a bigger picture of the laptop, since I've just sort of revealed it to folks this way without a lot of detail.
The students are going to be not provided with it. They will be paying for it on their own. They may be able to use some of their financial aid funds for it. Students have already been notified, and there's actually on the IT website under user services, there's a link with the requirements.
Thank you.
Okay, the next question is, once decisions are made about how instruction will be delivered in each course section, there may be drop ads. That seems like it could be a little chaotic. Do you anticipate issues with that, or how do you think it'll go?
You know, probably it could happen in there. What I'm this morning, I had an email to Jonathan and Susan Astorita in Registrar's office. What exactly do we want to say? What's appropriate to say in the schedule of classes for students? We want to make sure we get that updated appropriately, because this will likely nuance between classes and those sorts of things. We wanted to have some sort of general language to describe it, but basically to signal that there's flexibility and particular kinds of ways. So we're hopeful it won't lead to a lot of that, but it could, depending on the nature of the circumstance. I guess the point I might also make is we need to be ready for the student who may come, whatever choice you've made for a student who may have an accommodation need, for the ability to not have to come on campus for their instruction. So how you design your course through the Blackboard Shelf, for example, for them to be able to access those materials or to participate in the class in the way that you need, does require thoughtfulness around those things. Thanks, Josh.
We also have a question about office hours and whether faculty can choose to make those virtual as well.
I would say in general, we should try to, Jill, maybe you can tag team this with me, that we should, wherever reasonable, we should try to have a reduced human footprint on the campus in that way. And so there's nothing particularly, I don't see problematic about an office hour. Key is accessibility to students by the faculty, and they understand how to get at accessibility. But Jill, you want to say something there?
Sure. So Charles and I have been busy even looking at faculty spaces and private offices, and we'll be giving recommendations. Most offices, it would be difficult to meet with a student with socially distancing. So we, if there is a need to meet with a student in person, we understand that as long as there's facial covering, and then maybe using, we've recommended alternate spaces. So if there's a conference room, if there's an empty classroom, if they have to meet with a student, we suggest doing that in all of our plans, but certainly not in a closed small room where social distancing is not feasible.
Thanks.
Just a note for Eric. we've had a couple of folks who, with regard to the laptops, have mentioned that a lot of faculty use Macs and asking that the proper cords and connections be available for those folks.
Yes, certainly we do provide the cords and connections that they need. Unfortunately, sometimes they get misplaced because they're adapters. So if anybody needs an adapter, certainly they just need to put in a help desk ticket and we will make sure that that's provided.
Okay, great. Thank you. We did have a question earlier, Josh. Someone was expressing concern with regard to the folks participating, the students participating via webcam, if there was potential for harassment of faculty through that channel. I would imagine if that's been an issue, it's come up over these last few months as well, and if there are ways to control or deal with that.
Sure. Let me tackle that in a couple different ways. First of all, if you use the Blackboard LMS system, you would, in your classroom, log in through the webcam, and Eric, you may help me here, through the LMS system. So the live streaming comes through the LMS, which isn't accessible to anyone else, okay? So it's protected that way. It can't be sort of put out there. It's also my understanding, Eric, that a student can't record that and then download it somewhere else, correct? That's why it's protected within the LMS environment.
I'm not certain if you can prevent the recording, because once something is on a PC, there's several tools that can be used for recording. Just as if someone was in a classroom, they can record things on their cell phone and you would be unaware of it. However, in terms of security, certainly you would want to make sure you use a password for all your webinars, and ideally do it that requires authentication through Blackboard or through Zoom authentication.
Let me also say that as part of the syllabus material that we're working on to provide you some scripts and things, that's part of the mix. For example, I heard about a student who's tuning in from their class at home, and mom or dad wants to sit in and see this class, right? Well, that can be inappropriate, right? So how do we properly prepare students for learning at a distance and the importance of the sanctity of the classroom setting? So there's some things we can do in there to help guide faculty to guide students on what's expected in that particular arena. This college is a learning opportunity. We want diversity of ideas that get engaged in a class, and be able to do that requires some context if you're not in that particular moment. So it's important that we think about that, and so we've been folding that in as well.
Thanks, Josh. Given where we are in terms of time, I think there's time for one more question, and then perhaps you have some closing remarks. The question is, if students need to proceed remotely, will they need to submit an accommodations request form?
Yes, so a student applies for an accommodation through the Accessibility Resources Center, like any other accommodation that they would do, and have the same criteria that are true for faculty and staff that were referenced earlier. And then with the approval of that office, that information is communicated to the student and the faculty member, and then that informs their accommodation for the class. So you're not forced to make a decision without verification that it's legitimate. Now, that may be different for a situation where a student asks for permission to be gone a particular day, or some other. You deal with those sorts of things all the time within the framework of your decision-making processes. But as it relates to this specific topic, that's how it would work.
Okay, we have just about a minute or two left, so I'll leave it to you as to whether you want to take one more question or make some closing remarks.
I think I'll just again say that the thing that has kept me motivated in all this has been the degree to which folks are willing to work together, roll up their sleeves, figure out the nuances, offer good suggestions to other colleagues. I just constantly hear about that, how faculty member X shares this good idea with faculty member Y, and then somewhere down the road I see a just amazing thing that they've done in a distant space. So I just can't say enough about how that is. None of us were given the playbook on how to navigate a coronavirus, but it is so empowering to know that good people are thinking deeply about that and that we keep students at the center of our mission. So that's all I got.
Great. So it's just about 1:15, and I think folks will be tuning in now for Vice President Camerata's section on student life and residence life. Thanks, Josh.
Mm-hmm.
Mickey, are you on?
Okay, yes. Good
Great.
afternoon. Good afternoon, everyone, and thank you for joining us. With me in the wings are, you've already met if you've been in the previous ones, Jill Guzman and Charles Lowe, the co-chairs for the pre-planning committee. And also with me are Glenn Sherman and Becky Baird, Glenn AVP and Dean of Students, and Becky, the Director of Residence Life. I'm going to invite my colleagues, Jill and Charles, if you want to go off camera briefly. They've been on from the very beginning. They're still here, but I give them a moment to go off camera while I do a little kind of introductory remarks. So what I'm really here to talk about, you can bring up the slideshow, please, is campus life with a particular focus on residence life. We understand that people have particular interest and concerns in this area, and also we want to reassure you about how we're thinking about our students and the student experience. Next slide, please. Just as a reminder, as I go through this presentation, and for those who have joined for this presentation, we are addressing some of the questions that were sent in advance, but you can also put your questions in chat. Greg Cannon is graciously monitoring those, and when we get to the end of the formal presentation, we'll address those with the help, perhaps, of my colleagues. So in terms of the overview, I just want you to hear a little bit about our guiding principles and how we're thinking about our students and life on campus. Obviously, life on campus is going to be different. However, for us, it's important that we continue to focus on a meaningful experience for our students. As you know, there'll be a number of students living on campus, and we have a large percentage of our students who commute. So even with the adjusted academic schedule and instruction, students will be on campus to utilize our facilities and to spend time among and with one another, and to engage with the programs and services that we will offer, obviously in the context of health and safety and physical distancing. We, in terms of what activities we'll think about as virtual versus on campus, obviously we're guided by CDC and the Office of the Secretary of Higher Education and the guidance that we've gotten in terms of physical distancing. But we also are mindful of the spaces, as Dr. Guzman mentioned earlier. But we want to have some in-person experiences for our students where it makes sense. And we'll prioritize those that we know it makes the difference to have that kind of high touch, not literally now, obviously, but that kind of experience so that students can be present in the same space with us. They're missing that. So finding the balance of that is really important. And that leads me to the third point, which I think is particularly important. I was struck by the comments of the students in the virtual commencements and honors ceremonies that I participated in. And one of the things they talked a lot about is mental health and well-being. And we know that's always been important to our students, but I think it's particularly important in the year ahead. Not only what they've been dealing with regarding the pandemic and the major shift, if they were a continuing student from college life as they know it to being remote, but also the climate we're in, the racial injustice and the just the political climate across our country and in our region. That's going to impact our students, and those are the kinds of things that they're going to be thinking about and talking about. And of course, it's important to maintain health and safety. And as I said before, comply with the policies. You know, we hear a lot of worry about the 18 to 25-year-old group or college students. Any of you who watch TV, the news, social media, etc., know that bad decision-making is not exclusive to 18 to 25-year-olds. We know that we work more with them, of course, to make those kinds of transitions and good decisions, but a majority of our students make good decisions. And if they don't, and they're properly sort of supported and educated, they shift to making good decisions. So we are planning on that, but of course also prepared for the students who need support and maybe a little bit more nudging to be sure that they follow the policies. Next slide, please. So this does not encompass all of the areas within student development or even across the campus, because campus life isn't owned exclusively by student development. I just wanted to put a few areas up here just so folks know who are on and listening that we are mindful of important and detailed planning in all of these key areas. But the focus of today is residence life. But I did want you to see that we're thinking about how we deliver our support services differently. Some of them were highly successful in a virtual format, and some of those programs will continue. And the support services that are more one-on-one, as you heard before, those will be addressed based on our ability to meet students in the offices or meet them virtually. But anything that can be moved virtually without doing harm to the relationship or the intentions or retention, our goals for students, we will do. And of course, if you're watching the news or watching what is happening across the region and the country, conversations about athletics and sports, those are ever evolving, and even the guidance in the state. So we continue to track that. We have very detailed plans, but that is still evolving. And as I said, the real focus today is going to be residence life. Next slide, please. I do want to say, for the good of the order, that many of you know this, but the university is preparing an opening or a planning, I'm not sure the title, so forgive me, Stuart, in the wings, but we will have a website up by probably around July 13th. That will really provide some detail in terms of the university's plans around opening. It addresses what the state is requiring of us, but also our own unique plans in terms of our opening. So let me talk a little bit about residence life. Many people worry about, how do we manage residence students? And as I said before, 18 to 25-year-olds or 23-year-olds can be challenging. However, they're excited to live on campus, and we expect them to follow the policies and procedures with education reinforcement, and when they don't, then we move into more progressive discipline and our own processes in any case where a student might not comply with the rules. So a few things that we've done in residence life. You may, again, if you're reading and thinking about these issues, you know that the goal overall is to reduce density, occupancy, family units or apartments or suites where students have chosen to live together or living together as a community. There are some flexibilities. However, our goal is to still reduce the density and the volume and number of students who are living on campus. So to that end, we have determined that we can support approximately a 65% occupancy rate. So clearly that means that we're not having doubles or having all students live together in bedrooms. However, there are some places where we will do that. That's why it's not 50%. For example, we have residence hall rooms, just to give you a sense, they range in square footage from 150 or 160 square feet to 335 square feet. For those of you who know the halls, High Mountain East and West, many of those rooms were built to be triples. So there are rooms where we will have double occupancy, but in most cases, the rooms will be single occupancy. So we can have anywhere from 2 to 3 students sharing a bathroom as opposed to 4 students in all places. We also are putting aside residence hall rooms, quadrant off together, if you will, for isolation or quarantine should we need to do that. Now, some of you may be concerned about the demand versus now the announced occupancy. Generally speaking, our occupancy rates can be anywhere from 84 to 88%. Our goal pre-COVID was 90% occupancy. Our demand right now, as of today, the demand in terms of students with contracts and deposits exceeds our ability to accommodate by about 124 students. We are currently polling students to understand which ones could, if they couldn't live on campus, could still attend the university. We're prioritizing around first-year students and students who don't have other housing alternatives or other reasonable housing alternatives. And we're also looking and talking to an area hotel about an accommodation there for hopefully just the first few weeks as we experience what's traditional in residence life. It's called a melt, where students say they're coming and then something changes and they don't come, so that we can have all the students who wish to live on campus live on campus. But some of our students have historically sought to live on campus beyond the posted deadlines, and we've been able to accommodate them. That will not be the case, or highly unlikely that can be the case this year. The other thing that we want you to know is that we've made modifications, as you'll see throughout the campus, to address physical distancing. And by the way, I use physical distancing interchangeably with social distancing, because maybe makes sense from a student affairs point of view, is this to me is not about socialization, it's about distance and space. Obviously there's certain socialization that is less favored because of it, but we really want to send a different kind of message around that concept. So moving furniture around, removing certain furniture, putting limits, putting lines in the, you've seen them in grocery stores, directionals, limits in elevators, all of those things will be in place throughout the campus and particularly in the residence halls. So you'll hear about that and students will see that. Next slide, please. Other things around health and safety, and some of this you've heard previously in the context, or some of you have, sorry, you may have just joined. There are a number of additional protocols and new equipment in place to heighten the type of sanitation that we do, the thoroughness of that, the frequency of that. As you've heard in the prior conversations, or we will say continuously, we can't guarantee that all surfaces will be sanitized and cleaned at all times. So some of the responsibility falls on the individual to decide what level of protection they want to add. But certainly the common areas, the common shared bathrooms, lounges, kitchens, to the degree they'll be allowed, will all have heightened cleaning and physical distancing. Within the residence hall rooms, private rooms and suites and apartments, there'll be signage that instructs resident students on how to maintain their spaces, and particularly in the bathrooms. As is typical in the residence life world, there are periodic inspections, and certainly that will remain true. And there might be opportunities for corrections there as well. But as I indicated at the beginning of these comments, we do rely to a certain extent with our employees, with our students, with ourselves on people making good decisions and following the rules. So as you heard before, students will be required, like everybody else, to wear facial coverings. Now, people have used the term when physical distancing isn't possible. I just want to qualify that a little bit more, and Jill, jump in if I'm mischaracterizing this. But the policy is going to be that you wear them whenever you're in the presence of others. Now, there has been a discussion about whether you can maintain physical distancing, but if you're traveling public spaces or hallways, you can't guarantee that. So the expectation is that people will wear those coverings. If a student is inside their residence among their peers that they live with, and in their bedroom, there's going to be more flexibility there, but they're going to be in bedrooms where there is also the ability to accomplish minimally the 6-foot distancing. You heard a little bit about impending policies. There will be one for faculty and staff as well as for students that Cabinet is reviewing right now for approval, but that really addresses self-monitoring of temperature and symptoms. And folks, as I understand it, will have to make a pledge, sign documents to indicate that they are willing to do this daily, and it'll be structured. There's literally a check sheet and a way to do this, but the details are forthcoming, but know that that is there. But will we be able to take people's temperatures at different points of entry or egress? No, that's not feasible. But we do have measures in place to at least remind people and be mindful of the importance to really kind of think about your health and check your health daily. Now, in athletics and some of the other areas, should we have fall sports, there are much more rigid rules and temperature checking occurring there. But in the general populace, it won't be done by employees. Restrictions on guests and visitors. The students will not be permitted to have visitors and guests as they've had in the past. Part of the goal is, of course, is to treat the residential community as an internal community. There are public spaces on main floors of buildings that will have some degree of sharing of use, not from the general community, but certainly within the residence halls. But there will be much more strict measures there. We also are discouraging non-essential travel. There'll be other policies in place regarding traveling to places where there are quarantines or self-isolation. But even beyond that, you know, we're trying to encourage or curtail students going home. I don't want to say going home every weekend, but maybe, but certainly coming and going frequently, because that does reduce the potential risk. And as I said before, we're designing our spaces. We're creating spaces for isolation and quarantine. Next slide, please. A little bit about dining services, just for your information. Lots of people have been asking about this too. You know, that's really a partner experience with the residential experience, but we also will have dining for the general populace, again, modified based on physical distancing and less contact or no contact. You'll see mobile apps and opportunities. For example, a student who wants to eat in the resident dining in Wayne, all you care to eat, self-help, those kinds of, not all of those measures will, not all of those things will be available because of the need to control the food and the preparation and the serving more. But we do want to allow for some dining experience, but it will be distanced, and students can check the app to see whether or not they can come in. You know, is it at capacity? Those kinds of things. And obviously for ordering, placing orders for pickup, and we also are discussing delivery. And I want to say here that for those of you who don't know, you'll soon hear, Aramark is the new dining services provider. The contract, we're just finalizing the contract this week, and we anticipate having further announcement about their presence and their program and the meal plans and the limited catering that they'll be able to offer as well. Frankly, just public service announcement. There will be some closures or modifications of services because think about it, they're losing about 45 or 40% or 35%. Not all the students in residence have meal plans of their business and diners, as well as we expect there'll be significantly less catering. So again, the purpose is to provide the students with a safe, engaging experience, to help them to understand what the expectations are. Some of the ways that we'll convey this information to students, you heard some of it previously. We will be sending mailings home. There's material in the orientation programs, which are virtual. We are scheduling town halls, both for the resident students and their parents, as well as for students at large. Those will be coming soon. We wanted to have all our ducks in a row around instruction and housing. We've just made some decisions this week about how we're moving on the housing structure. So Becky or Glenn will correct me if I'm wrong, but they will be now reaching out to students to start to do placement. Usually when students indicate their wish to live on campus, they identify where they'd like to live, who they'd like to live with, and they're placed. We had to delay that whole process because of the circumstances that we're in. So they'll start to roll out now that process next week. So students will start to hear about what's happening with them in the residence halls. And again, we will be polling them and trying to understand where the greatest need is and the greatest risk for our students in terms of health or safety or needing to live on campus. So that ends my formal comments. I will speak to one question that I saw in the advance, and then we'll move to Glenn with the, to Greg Cannon with the questions that he might see in the chat. And that is, again, student behavior. You know, one of the questions that was sent in advance was worried about things that they've heard about other college students and being dismissive about the virus or feeling invincible or feeling like they're not going to get it. And yes, we've seen that, but we've also seen students be very concerned. They've lost family members or people that are close to them. So I think what challenged us maybe last year, I do think that students have really started to see how serious this is. But I also recognize that there's this, anxiousness to get back to college, get back to normal, and have fun. So again, we will do our best to manage that behavior through education, through support. We're envisioning our peer health advocates serving as ambassadors, i.e. to help folks who are worried about confronting or talking to people without masks or facial coverings, which will not just be students. I've seen it myself. We have to do it for each other too, is ambassadors walking around and offering a mask and a little education and talking about why the mask is important. So we will keep working at it. It's important, but also our students' well-being and their ability to have a meaningful, pleasurable college experience safely is important to us. So Becky or Glenn, anything critical that you think I might have left off that should be included?
Nothing that I can think of.
Okay, so I guess, Beck?
No, I think we're good.
Okay, so Greg Cannon, why don't we go to the questions?
Okay, Nikki, thank you. I know you did talk about the communication with students.
Yes.
Someone is asking specifically, will there be a mini clinic in each residence hall?
No, I don't think that's practical, nor is it safe. I mean, Jill can say differently. I think that it would be important that we use telehealth for initial assessment, and then Counseling Health and Wellness will direct them on where they should go, come to the health center, stay put, isolation, quarantine. I would worry about multiplying that kind of service. But Jill, I don't know if you have anything to add to that.
Sure. So from a health perspective, containment is the most important thing. And so my department, as far as Counseling Health and Wellness, has strict protocols in place for the screening even before anybody would walk into my office. So, we would really want to regulate that. And we're not saying we're not seeing people in person. We're just asking if you've been to the doctors during this COVID-19 outbreak, that we want to screen you before coming in and then give direction on what to do, making sure, reminding them about their face coverings and what's their temperature and screening them prior. So all that communication will take place with students. They'll be informed about our practices and what we need to do prior. And we'll be working with Residence Hall on an education plan for that.
And you know what? Becky was probably too kind to tell me, but something I didn't really emphasize were the policies and procedures. And we are adding to the resident contract a contract or an addendum to that contract that speaks specifically to the expectations. And soon all will see the health check and the I may not be using the exact language, but the health check expectations, and to Jill's point, what you do if. So it's very prescriptive. So it shouldn't leave too much for mystery.
Thanks, Mickey, and thank you, Jill. With regard to dining, we have someone asking if you could elaborate on what limited catering would look like. And then also someone is asking if Valley Road Cafe will be open.
Okay, thank you. We're still hammering out some of the details with Aramark. I will say that the Valley Road Cafe is expected to be open. It might have more limited hours, but we recognize the importance of that for College of Ed, College of Business. If we end up with the hotel there are a number of reasons why that makes sense to us. There might be other limitations, like the W store is it's smaller, and late night dining might be a little different for the students. We're still working out those details. Catering, they'll have up a catering menu. It'll probably be more contactless or grab and go or sort of packaged delivery. But I imagine that they'll still do VIP or services and for programs that can be accomplished in a physical distance manner. So if there is a wish to have catering on campus and it meets the criteria in terms of physical distancing and food handling, then they'll do it. I don't know if I hope that helps.
Thanks, Mickey. So switching for a moment from residence life, we have someone asking when decisions will be made on athletics and activities, and then also wondering if the student center will be open.
Yes, the student center will be open. Some of the decisions around campus activities have already occurred or in the works. I know that the team in Castle, as well as some of our other partnering areas, the Women's Center, the Center for Diversity and Inclusion, the Black Cultural Center, there's been lots of conversation and collaboration around what to hold. And they've met with student groups, Student Activities Program Board, SGA, some of the club leaders to kind of talk that through. So I think they have that pretty much hammered out. But it's not, I'm awaiting a formal plan on that. We have the campus activities plan from our end, but we're just finalizing the student end. There was another, athletics, lest I forget. So that's evolving. There's a continuing discussion about whether we can deliver our fall sports safely and meeting the distancing requirements. I can tell you already that preseason, even if we were to decide to go today, there are already things that have been put in place. Sabrina Grant, Director of Athletics, has put together a thorough study and in consultation with the health advice, with Jill, with our colleagues across the conference, has protocols in place should we continue with some level of athletic competition, but it would be much more limited if we had it in terms of time, length of season, amount of transportation, the type of transportation, what competitions are played, and all kinds of protocols for temperature checks and testing and tracing. But again, we're not even sure at this point. There's still discussion in the conference. There's still discussion among the presidents of our conference institutions. They actually have a conversation late next week. So more to come. And by the way, the same would be true with club sports and intramural sports. There are similar types of plans and waits and sees a little bit around some of the conferences and what decisions we're going to make. Because normally you'd want to make a decision as a collective, or at least communicate it in a way that students understand what their options are.
Great, thank you. There's a question asking if there can be more specifics, given in how priority is given for residence halls, for example, out of state versus in-state, students with housing insecurity, et cetera.
Sure. And Cabinet, Glenn and Becky put together a very thorough review of this with lots of considerations, and there are a lot of them. So there were a few guiding principles or priorities that we put in there. One is we want to, as much as possible, to accommodate our first-time, full-time, our new students. And happily, as of today, the halls that they are designated to live in, we can accommodate them. I heard earlier in the week, maybe we had 40 spaces left, but we had one more day left before the deadline. So, unless my colleagues tell me something different, I think that we're feeling pretty comfortable about our ability to meet the freshman need. In terms of the hotels or wait lists, the hotels, if we were to use a hotel, and we only have 38 spaces possible if we were to use the hotel, that would generally be upper class students with a little more flexibility, a little more college experience. We certainly wouldn't put freshmen or probably even sophomores in a hotel environment. In terms of the pecking order after freshmen, we know that there's obviously one of the university's priorities is first year to second year retention. So we recognize that sophomores are a critical group. We also have cohorts, EOF, student athletes. So all of those are being considered in the mix. And the survey, as I mentioned before, so students say, I can still attend if I don't live on campus. I just prefer to live on campus, versus the student who says, I can't live on campus. And the other piece of the mix that was in the question, Greg, is international students. And of course, that's a piece as well. So right now, as it all swirls around, as I mentioned earlier, we believe we can accommodate all of the students in one form or another who have submitted their contract and paid their deposit. The deadline for that was May 29th. However, there are often 300 or 400 students in the wings who have done some part of that, but have not finished the process. So we will do the best that we can if we continue to get students asking, but we'll have a wait list. And again, use the priorities I just outlined. Becky or Glenn, anything to add to that?
I would just add that we're also sensitive to issues like housing insecurity, students whose home situations are unsafe for one reason or another, those kinds of things. That's part of the state guidelines, and it's a value that we've had for quite some time. So that'll be in the mix as well.
Yes, good point.
Okay, so we have just a minute or two left. I have one more question in two parts that I'll put them together, and you can make some closing remarks if you like, Mickey. So we have folks asking if students will be offered free COVID testing, and referring back to the mention of thermometers and temperature checks, whether students will be provided with thermometers so that they can self-monitor.
You know, I hate to kick things to Jill that I can answer, but I'm afraid I'd be guessing too much at that one. I've seen some written on that, but Jill, would you mind telling us where we are right now with that?
Sure. So we are trying at this moment to purchase small digital thermometers for every residential student. So it's just a matter of obtaining those supplies, but we are trying to do that. And Becky's on our committee as well. So we have put that in place. Right now, we are working out a testing procedure for in-house testing. There is a cost. We were just trying to weigh options and what's available to us. So yes, there will be some type of testing available. Now that students are insured, that eases a little bit because we will have people that are insured and we can bill for insurance without a huge deficit to us. So yes, we will be able to offer some type of testing. Just not sure if it's a self-swab or what that means.
Okay. All right, great. Thank you, Jill. Well, I think that's all the time we have. I don't know if there's some sort of cutoff, so I don't want to have that happen to us. So again, thank you all for your interest in student life and the student experience. I'm happy to answer questions offline. So if folks want to send emails, don't send them to Jill and Charles. Let that process work its way through. But if there's something I spoke to that you have a particular question about, you can direct that to me. And again, thank you very much. We'll have more communications going forward as the details become more clear. Stay safe, be well on behalf of all of my colleagues. Unless the president wants last words, I think we're a wrap.
Thanks, Mickey. First off, let me thank you and Vice President Boucher Jarvis and the Provost for your good work, along with Jill and Charles. I know that this is a mammoth task and we don't have a roadmap to follow. So not only are we making the map while we perform the tasks, but I think we have to sort of recognize now as a community that we do have a shared responsibility to each other's health. And if you think about it, we have been engaged in these practices all along. We stop at stop signs. We drive on the right side of the road. We stop at stoplights. We use common sanitation. We collect garbage. We do all of this kind of stuff in the interest of protecting each other. And wearing face masks and social distancing and washing our hands and using hand sanitizer will be part of that new collective of caring for each other and caring for our community. So I want to thank you, and I hope that you will keep engaging in the town halls as we have more information to share. But please know that we are all doing our best to protect everyone as best we can. The university needs to continue to exist for our students. We know that the pandemic has impacted the communities that we serve in greater numbers and to a greater extent. So let us begin to think about what we can do for them while we continue to think about what we can do for ourselves to keep ourselves safe. Thank everyone and have a great weekend.